Okay, this week we'll be on chapter 7, which is covering bone. Bone as a tissue, and we'll also be looking at the bone overall as a, not necessarily an organ, but the gross anatomy of a bone. You'll be seeing the prefix os quite a bit from the Latin for bone. Osteology is the study of bone, and we know that our skeletal system is made of bones, cartilage, and ligaments. We'll talk about cartilage and ligaments and tendons a little bit, but mostly focusing on bone. The functions of the skeletal system are support, protection, and movement. They hold the body up, supports muscles, and the mandible and maxilla support the teeth. Those are both bones. Protection, of course, protecting brain, spinal cord, heart, and lungs. And then movement, including limb movements, but also breathing, and then the action of all of our muscles. Some less obvious functions include electrolyte balance. So we're going to talk about calcium specifically as an ion and when it's absorbed and when it's not. The acid-base balance, which helps buffer against excessive pH changes in the blood. And then blood formation. Red bone marrow is the area that is producing blood cells. So bone tissue is also called osseous tissue. It is a connective tissue. Sometimes I forget that it's a connective tissue because it doesn't seem like it has much of a matrix, but it is. The matrix is hardened by calcium phosphate and other minerals. So it doesn't look like other connective tissues. And then the calcification or mineralization is the hardening process of the bone. An individual bone is made of bone tissue, which we will have a separate video on, bone marrow, blood, cartilage, adipose tissue, which is mostly fat, nervous tissue, and fibrous connective tissue. So when we talk about bone, that's more than just bone tissue. But that bone continually remodels itself and then has an interaction with all of the other organ systems in the body when you're talking about function. So we'll get to all of the functions in separate videos. But it is permeated with nerves and blood vessels, which is why it is sensitive and how it is involved in the metabolic activity of the body. So we can break up our bones into different shapes. We think of long bones as the first and foremost, but there's more. So long bones are classified as longer than wide. And when you're in the lab next week, you will be focusing on bones next week, and bones will take a little bit. So, but long bones are longer than wide, and they are rigid levers acted upon by muscles. So those long bones is where we see a lot of our limb movements. Short bones are equal in length and width. They glide across each other in multiple directions. When we get to joints, we'll talk about all of these movements. Flat bones are exactly what they sound like. Your sternum is an example of a flat bone, or your scapula. They are curved but thin. And then irregular bones are elaborate shapes that really don't fit into any other category. So they're not flat, not short, not long. They must be irregular. So an example is your talus, which is your heel. So when we are looking at bones in general, we see some features in all bones. So one example is compact bone, and it's the outer shell of the long bones, which most of the bones that we're going to look at are long bones. And then of that long bone, it has a shaft, which is called the diaphysis. That's the cylinder of compact bone. And then inside that diaphysis is the medullary cavity, and we think about that as usually the marrow cavity. That's the space in that long bone that contains the bone marrow. And then the ends of the long bones that are kind of enlarged or look like bulbs at the end, that's called the epiphysis. Those areas are strengthen the joints by having a wider point of attachment and serves as an attachment for ligaments and tendons. In those long bones, we'll also see spongy bone. I will call it spongy bone and not cancellous bone, but it is covered by compact bone. So you'll see in the lab under the microscope, you'll see the difference between spongy and compact, but spongy is covered by compact. Spongy bone is found in the ends of the long bones, and in the middle of nearly all the other bones. But if we're looking at kind of a pie chart, we would expect to see the skeleton have 3/4 of compact bone and 1/4 spongy bone if we're looking at by weight. We'll also see in these long bones, and really all the bones, articular cartilage. It's a layer of hyaline cartilage that covers the joint surface where one bone meets the next, and it allows those joints to move more freely with less friction, and we'll get more in depth with that when we get into joints. And then we'll have these teeny holes in the bone surface where the blood vessels pass through, and those are called nutrient foramina. There is a covering of the bone called the periosteum. It's kind of an external sheath, except where there is articular cartilage. So it basically covers all of the bone except for the ends where the joints are occurring. The outer layer is made of fibrous tissue, and some of the outer fibers are penetrating into the bone matrix, and those are called perforating fibers or Sharpie fibers. They basically help that strong attachment from muscle to tendon to bone. And then there's an inner layer of the periosteum, which has these bone-forming cells called osteogenic cells. Not only are you going to see the prefix os, but osteo is quite a bit. And those cells are important for the growth of bone and also for the healing of fractures. Lining the marrow cavity or the medullary cavity, we're going to see another kind of layer of tissue, and that is called the endosteum. And it is a thin layer, and here we see cells that dissolve osseous tissue, and then we also see cells that deposit osseous tissue. And we'll talk about each of those as we go on. And then we also see at the ends of each of these long bones a growth plate, which is called the epiphyseal plate. And again, it's an area of cartilage, hyaline cartilage, and it separates the marrow space of the epiphysis and the diaphysis. So basically is a little line that kind of is the border between the epiphysis and the diaphysis. It does enable growth in length, so the long bone getting longer, if you want to think about it that way. And that will see an epiphyseal plate when the bone is continuing to grow. Once it is done growing, we'll see an epiphyseal line, which is what we see in adults, and it's a little scar that marks where the growth plate used to be. So here's a picture to kind of put all of that into perspective. So we see the diaphysis is the shaft part of the bone, the epiphysis is the ends. Sometimes you'll see distal epiphysis or proximal epiphysis depending on which bone we're talking about. On the arms and legs we see that a lot. Just clarifying which end is which. And then inside the diaphysis you see that marrow cavity. Really you should call it the medullary cavity. And then covering the epiphysis you see that little layer of articular cartilage. And then not all pictures are going to actually show the periosteum, but it is covering the diaphysis. But a lot of times you will see a little layer or a little line pointing to the endosteum, which is inside that medullary cavity. Okay, if we look at a flat bone, the structure is a little bit different. There's not that long bone, so there's a few things that are different. It kind of is constructed like a sandwich. There's 2 layers of compact bone and then a layer of spongy bone in the middle. And both surfaces of the flat bone are covered with periosteum. So we see this in the skull. We also see sutures, which are kind of boundaries in between where those flat bones meet, which you'll get to see that in the lab.